All right, tonight we have a special meet and greet. If anyone's been with this practice more than a few months, you've probably noticed some growth. Certainly over the last 10 years, we've changed dramatically. And the infrastructure of the organization is keeping up with the size of the organization. And so we have a new COO, and we're thrilled to introduce Julie to you all. And time and attention means to have more patients, we need to have more doctors. And we're also thrilled to welcome Dr. Deepu Thomas. So I'm going to turn it over to our CEO, who should be familiar to everyone, LeClair, and take it away.
Great. Well, thank you all, those of you in the room and on the global stage here, tuning in to TCL Live. Yeah, as Melanie said, we have experienced a lot of growth, largely, in response to the needs of the community, and all of you provide a lot of feedback regarding the type of services we need to offer, and we do not steer far from our core mission of time and attention, focus on the patient and the caregiver. And so these education sessions are really, really vital, and a commitment we have to all of you and to the broader community. So thank you again for joining. As CEO, I've been here for 4 years in October, hard to believe. And it's been just wonderful. Dr. Edwards, our renowned founder, always tells me, especially when I've got a lot going on, he goes, you've been training your entire life for this job. And he reminds me of that all the time. I think it's his way of inspiring me to continue to move forward. But it has been really the ultimate joy of my life to be here, and especially getting to work with such a fantastic team. And we have 2 incredible team members who have just joined us. So I'm really pleased to spend some time with Dr. Thomas. Hails from Massachusetts, and so we're going to talk a little bit about your background and why you sought medicine as a career, your passion. I will say that Dr. Thomas has definitely hit the ground running and is already viewed as the Zen physician. He's so calm and so serene, and it's wonderful. We appreciate it because most of us are in overdrive. So it's wonderful to have you here, and look forward to having everybody get to know you a little better. And then on my left, Julie Carroll, our new COO, who has been just phenomenal. I really can't say enough about her. With our growth, our board was very insistent on getting me some additional help, and that help really needed to be someone very like-minded like me, who has a lot of drive, a lot of passion, who can see things big picture, but get things done. And I think we were separated at birth. We have more in common, and we have a lot of shared experiences. So I'm thrilled to have Julie here. She's 2 months in, and it's like she's been here forever. And so you're going to learn more about her background, and just the impact she's had in her short tenure here. So it's been wonderful. So why don't we start out on kind of a personal level? As you know, Memory Movement Charlotte, what makes us so special is our team. And we're very relational. We're very much a community here. And it's really important that we know each other on a very personal level and make sure that we're providing an opportunity for everybody to feel very fulfilled and very successful here. So we'll start with you. So tell us a little bit about you, your background, why you chose medicine, and you hail from India. Would love to hear your perspective on the differences between, what you experience here in the U.S. versus India.
Yeah, thank you, first of all, to you all, especially this time of the day, to be here. And I think the first time I came to the U.S., I was really lost in the sense that there's nobody in that part of the world other than my sister, who is somewhere in Minnesota. But I was pursuing a career in internal medicine. But prior to that, I was in the UK for a couple of years pursuing a career in surgery. which was my passion before. And once I got into taste what it felt like, my dad was a surgeon. He said, you need to have a lion's heart, a lady's finger, and an eagle's eye to be a surgeon.
Oh.
And I didn't have the lion's heart, so so I decided to switch my career to internal medicine, and it was a great journey for me. Being a foreigner coming from India, I was on a visa, so I had to go to healthcare provider shortage area, and it was so great that I learned a lot from my patients. It was a journey of 12 years, I would say. I learned more than what my patients probably got from me. They taught me a lot. And towards the latter part of my career as a primary care internist, I decided to switch to geriatrics because that's something that I really cared about. And both my wife's mom and my mom are getting into that age, and seeing them not struggling, but not up to what they were before. I felt like I need to get equipped for that, that caregiver role. And that really prompted me to switch to that career. And I did my fellowship, and I was blessed to be part of a team which looked at geriatric medicine as a serious specialty. As you probably know, there are not enough geriatric medicine specialists in the whole country. We probably need 10 times of what we have right now to meet all the needs right now. So imagine what it will be 10, 15 years from now. I learned a lot as a fellow, and then I learned a lot, even more as a physician in that field. And while I was thinking about what I should do, and being in an academic position, I could pursue that ladder and go up the ladder. But then I think I had to kind of prioritize my family, where my wife's family is here in Charlotte. So she has been talking to me every winter, actually, trying to get down here. So I had to give in to her. And so a mutual friend actually introduced me to Sanjay. And the first call I had with him, I fell in love with the practice. What you do with the time and attention model is what I envisioned in my practice as a geriatrician. And what we didn't have as a primary care, it was that. So a lot I fell in love with the first conversation I had. So I didn't have to think twice to tell him, I would love to be part of this. And so then the rest is history. And I'm here. I'm glad that I've been given this time to build what I can do and how I can be helpful here. I think another thing that really helped me is to understand how important caregiver role is for somebody who is living with dementia. We are trained to address that, but we don't have enough resources for that. And I'm glad to see that here there's a lot of resources that are available. And where I used to work, we struggled to find resources for our patients. And I'm really glad that we have that support here. I don't want to keep going. I want to be mindful of time too.
Oh, great. Well, I remember one of the first conversations we had with you was you sharing with us that this is exactly the practice you envisioned and you wanted to start yourself. And it was like, just amazing, how fortuitous for you to get through a connection. Actually, another physician we were talking to who said, "Oh, you've got to meet Deepu Chamas." So it really worked out wonderfully. Yeah. So no, that's great. Good. Julie. So Julie's been here, 2 months now?
Not quite. Yeah.
No.
6 weeks.
Oh, no. More than
7 weeks.
7 weeks. Okay. All right.
You don't split the difference.
Okay. Well, tell us a little bit about your background and how you found us as well.
Well, as I've mentioned to some of you all here in the room, I grew up in Winchester, Virginia, and my father was a neurologist and one of the most brilliant and compassionate people I've ever known. And he was lucky enough to be able to practice medicine before the imposition of managed care and the accompanying bureaucratic hurdles and paperwork limitations that entailed. And so what I learned from him was that it was very important to understand the patient and their family and their background and get that bigger picture, because you could see a patient and they may be having chronic headaches. Well, that could be a sign of something that was a serious medical issue, or it could be the result of a job loss or a difficult divorce or some other thing that happened in their life. And so in order to be able to effectively treat that patient, it was important to understand what else was going on in their life and to be able to spend the time with them and to figure that out. So I like to think that Dad was practicing the time and attention model long before it was ever a thing at MNC. And I think he and Dr. Edwards would have really liked each other. But that was my experience with what it's like to work with a neurologist who really spends that time with their patients to understand their needs as well as their family's needs and to help them both along their journey with one of these diagnoses. I personally, my training is as an attorney. I loved it. My little sister will tell you it's because I like to argue with her so much. But I worked in the federal courts and I trained in a litigation practice and really enjoyed it. It was the challenges involved in the strategy planning sessions and going through lots of documents and information and sifting through that and working towards a joint goal. All that was really right up my alley. And then most recently, I've been working at the University of North Carolina at Charlotte with a collaborative partnership there between the university's Department of Public Health and then the Mecklenburg County Health Department. And that work was much more focused on operations and grant management and taught me a lot about the many layers of organization and follow-up and compliance and all of what it takes on a day-to-day basis to run a large organization. I spent a number of years in between those two with my family, raising our children, and the time that I spent with them and focused on their growth and development and their education was definitely the most difficult, but also the most rewarding job I've ever had. I'm proud to say that both of them are now grown and flown, and our daughter's now an audiologist over in Winston-Salem with Atrium Wake Forest Baptist, and our son is an elementary school teacher in Nashville, Tennessee. And they've both chosen service type professions where they're able to help other people and make their lives better on a day-to-day basis. And they make me proud every single day. Mm-hmm. So I feel like in each of these three iterations, and now my fourth, I've learned different skills along the way and different ways of dealing with different groups and different ways to approach things and be more effective as a strategist and a problem solver.
Mm-hmm. Great. Well, and perfect skill set for us as we really enter our second decade and are planning, what growth looks like for Memory Movement Charlotte. And it's an exciting time. And Julie's background, experience, and just intellect have been really, really helpful so far. So just staying with Julie a little bit, talk a little bit about initiative that you have been working on called Guide. I think probably read about that through some of the great communications that Melanie has done, but I thought maybe spend a little time talking about the program, the significance of that program for our practice, for our community, and for us on a national level.
Sure. I'm really excited to be working with the Guide pilot program that is part of a nationwide study that was started by Medicare just in July of this year. It is a fantastic pilot program that is essentially rolling out the time and attention care model that we have here at Memory Movement Charlotte to the rest of the country. And it is a very different way of looking at providing dementia care in that it is focused on both obviously providing the best medical care possible for the patient, but also providing wraparound comprehensive services for care management, additional education and supports for the family members. And in doing so, it hopes to at some point change the way care is provided and paid for through the Medicare system. And it's an 8-year study, so we're in it for the long haul and excited at the opportunity to be able to show people in the rest of the country what we're already doing here that's worked so well. I would say that probably a number of current MMC patients, if you decide to participate in the program, you probably won't see anything dramatically different because, like we said, we're already doing most of these things. But there are a few additional services that are offered as part of the Guide program, including respite care, some respite care options, a 24/7 line, home evaluations, and more frequent touch points with our family care navigators, if you've worked with any of them, who are great, and they are totally focused on providing support to families and to help them with this journey that the whole family is on. And so I think that the program, as it rolls out, we're excited that it's just started, as you said, just a couple months ago, and we've started enrolling current patients in it now. And if any of you all are interested in participating in the program, we'd love to talk to you about it more. We've got more information we can provide if you'd like to look over that. And we hope that you, even if it's not a huge change to you, it does provide some additional services. And then you're also helping all of the hundreds of thousands of other seniors in the United States who don't have a Memory Movement Charlotte. So I think long-term, it's going to be a great option to try to demonstrate how this kind of comprehensive service limits ER visits, hospital stays, and long-term nursing care, and reduces caregiver stress and improves the life situation for the patient with dementia.
Yeah, and it's interesting, Medicare and all the insurance world is so complex and usually not everybody's friend. It's always difficult to navigate. But I will give Medicare a shout out on this project. It certainly has been interesting in terms of our rollout, but they put a lot of thought into this, and they've been thinking about it for a long time, and they really, really believe fundamentally that caring for the caregiver really improves not only the life of the caregiver, but the patient as well, and will reduce long-term costs overall. And so part of it is how do we preserve our safety net of a healthcare system, our Medicare program? How do we preserve it for the long term? But more importantly, how do we really get down to the fundamentals of what we all deserve as Americans in terms of quality care? So we're part of this study because we really believe this is important, not just for us, but for the entire nation. And as Dr. Edwards said, hey, we need to go up there and teach them how it's done. And and we would love to do that. There are only 96 practices across the nation that are implementing this year, and we're one of 96. So it's really important what we're doing. We've always viewed ourselves as innovative, as leading edge. And this is another example where, we are taking that bold step forward. And that's really in, consistent with Dr. Edwards' vision for starting this practice. So we feel like it's very much aligned philosophically with how we manage the practice going forward. So anyway, thank you for your leadership on this. She's been a real help, especially that legal background that's been helpful with every document you get is 95 pages. So it's really, so that all she said about, I love those big documents. We're like, we love that you love those big documents. So it's been very, very helpful. So let's switch over to you. One of the interesting things is having a geriatrician in our practice. We have neurologists. Dr. Edwards was a cardiologist and a memory, became a memory expert. We affectionately refer to you as a memory expert. And so talk a little bit about how you see the differences between neurology, geriatrician, and what the intersection and what complementary of those two practices.
Thank you. I feel that both neurology and geriatric medicine are subspecialties of internal medicine. And you can deviate to one way or the other, but when it comes to memory care, they both align at certain points. And I feel that with geriatric medicine, it is more of an elaborate, bigger picture kind of dive in. Neurology does that, but at the same time, they are also focused on a little bit more focused than geriatric medicine. But I think we all understand the value of early detection of dementia or memory issues. We all understand the importance of managing that. We all understand the importance of caregiver support. I think that is where we kind of collaborate. And what we also understand is how we can have different people kind of help, different specialties. How can we collaborate with other specialties like PT, OT, speech therapy, care managers, social workers? How can we bring them all together to help the person and the caregiver? So I think my training in geriatric medicine also involves addressing a little bit more of aging population and the frailty of that. And also, I like to address internal medicine problems as well, including, I have a philosophy that more is probably not good sometimes. We try to cut back on medicines as much as we can. So that's also something that I like to do along with managing memory. But I think overall, managing memory, we collaborate, and I'm so glad to kind of speak to one of the neurologists and hey, I think this is what the issue is, if it is a neurological problem, and they are happy to help me out here. And they are experts in that field, and I'm glad that I have that availability, especially when there is somebody who is an expert in movement sort of specialty too, because they you see that a lot with somebody with memory issues.
Yeah. Well, that's a great segue. Hopefully I'll have a coffee back here. Segue into our practice where we have both the memory and the movement. And about 2/3 of our practice is memory and a third movement. Of course, Dr. Iyer is our movement specialist and our medical director. So I know you're early in on your tenure here, so just really a little over a month, right? But just wonder, how you envision supporting both the memory and the movement side of the practice. Most of your patients are on the memory side at this point, so.
That's right. I feel that in my training, I'm being trained to evaluate not just memory. I'm trained to evaluate movement disorders. I'm trained to evaluate fall risks. So I'm exposed to that, and it's part of what I do. Obviously, when it comes to the nitty-gritty of it, we have the expertise of a movement disorder specialist here. So and they're willing to help me out when I ask for help. And I always think that when two brains works together, it's better than one brain. So I think the collaboration is what I enjoy. And with geriatric medicine, we have something called age-friendly healthcare system. And we do evaluate not just a particular, so for example, if somebody comes from memory, I don't just evaluate memory. I think about their movement. I think about their medicines. I think about what matters most for that person and the family. I think about other conditions that they carry. So I try to have a bigger picture and treat my evaluation and treatment will be based on everything, not just that particular aspect of memory problem.
Mm-hmm. Great. People often ask, what's the most important thing I can do now? If you're in your 70s, 80s, what's the biggest bang for your buck in terms of focus on nutrition, exercise? What do you often recommend for people?
I certainly think that shouldn't start at 70.
Sometimes your window's closed, yeah.
Yes, I think we should start. Probably the best age to start that is in your 40s and 50s. We don't really think about that until we turn 65. So start early. And I think the key components of what we say good for brain health is, number one, I talk about sleep, how good your sleep is. Are you valuing your sleep, and or are you in front of your phone or your computer instead of taking that time to sleep? The other thing is how good your education. So I always say that if there is something that you can learn in your 40s and 50s and 60s and 70s or 80s even, keep learning, because I think the learning will keep your brain cells working better, your circuits working better. So continued education, whatever it may be, it might be a recipe that you want to try out, or it might be a music lesson that you want to do. So I think that really helps. The other thing is exercise. So I cannot impress upon you enough that exercise is such a vital part, not just for the brain health, but also for your cardiovascular system, for your balance. Imagine somebody has everything but no balance. They fall and have problems, you end up having further problems because of that. So the balance and the exercise is important. Diet, obviously what goes in is what gives you the energy and the nutrients. So I feel that the appropriate diet, and there are certain diets that might be helpful for deterring dementia in some people. So I also think that socialization is important along with education. That will help with some of the other circuits in the brain to continue to work. More than that, I think it is understanding your body and understanding what matters most for you. I feel that we are still, as we age, many people know what they really want, but they cannot voice it out. And I think the first thing when you come to me, I ask this question, what really matters for you is important. When I come up with a suggestion, if that really doesn't fit with or align with what you really want, then I'm not going to do any service to you. So I think it's important to ask that question to yourself, what really matters to me? And the caregivers to ask the family, what do you really want? And align the care and with what they really want is what I suggest. So I think I went overboard. But
No. It really is helpful, and to kind of operate on all cylinders. It's interesting. Many of our patients have PT and speech therapy and occupational therapy. And it's interesting to see the benefit of that. And it's really multidimensional. Typically, but now it's so much in the home now. That's what COVID's really opened that door to have therapy in the home. And so you're getting the physical exercise, you're strengthening your muscles to prevent fall risk. The socialization and relationship you're forming with that therapist is so important. And we find many of people, they don't want to give up the therapy because they just really enjoy, that one-on-one time and the relational aspect of that, and knowing somebody's really trying to improve the quality of their life. So that's so important. And, then you're, talking about, healthy eating habits. And so all the things, and we're really exploring, from a services expansion perspective, what can we do in some of those educational, lifestyle education components? So that's where, Julie and our, next projects, and we're always thinking about that. We're really embarking on really how to define our expansion of services in the next couple of years and getting more into the prevention, more in the research. So there's a lot coming down the pike in terms of what we're exploring, all in response to the changing landscape out in terms of progress in some of the, treatment programs. But also, we, all of you are becoming much more personal advocates of your own health and more educated and bringing, ideas and to us as well. So we want to be very responsive to that. With that, Julie, thinking about, I know 7 weeks in, and, you've really, you've seen a lot in 7 weeks. I think you've had definitely full immersion. Just talk a little bit about, when you accepted this role, what you thought it might be compared to what it is. And remember, we're being taped here, so and no career-ending comments. But other than that, you can say whatever you want.
Okay. Well, I was obviously in conversations that we'd had with you before I came on board, and with other people here in the clinic. Was very impressed by the time and attention model, which I think is something you're going to hear again and again, whether it's from somebody that works here or a patient or a caregiver. That makes all the difference, and that it's almost a return to more of a old school medicine, where like the small town doctor who knew your family and knew everything about you and could help you out and answer your questions and give you advice and provide that kind of that support you needed. And so that obviously is the driving force behind all of this. But I guess the thing, as I look, in my crystal ball down the road in the future, as far as MMC, I mean, I think before we even talk about anything like that, we have to recognize all that's taken place in the last 5 years under your leadership, and that as when you came on board and all the infrastructure that you built up and the processes and procedures that you put in place and the staffing. I mean, Janet knows this, but I don't know if all of you all do. I mean, in the time that she's been here, we've effectively doubled in size, and she's brought on additional staff to help with this new guide initiative. I'm helping operationally. We've got new nursing staff and family care navigators to help deal with the increased need and demand from families that were interested in being patients here at Memory Move in Charlotte. So, with that being said, I think we've got, as we look forward, there are a number of opportunities and some corresponding challenges with those opportunities, of course. But one of the things I think we always need to keep in mind is that as in a lot of developed countries, we are having a lower birth rate and a longer lifespan. And so that's resulting in a population that skews older. And in North Carolina, by 2031, which is just 7 years from now, demographers estimate that we'll have more people over 65 in our state than we will under 18. And now that the time between the traditional retirement and the end of a person's natural lifespan is not just a few years anymore, it's a few decades. And so I think that one of our challenges is finding a way to continue to help people make the most of that time, and then to be able to spend that with their families and the people they care about, and to do what they want to be able to do at that time in their lives. We need to grow and expand to meet that growing demand and that need. And I think that's one of the things that's always on the top of the to-do list is how do we address that? And the corresponding space and staffing that will require. And then coming down the road, we also have all of these exciting new treatment modalities and medications and other potential ways to address dementia and Parkinson's that were not necessarily available before. So it's important for us to stay on top of that, so we stay at the cutting edge of treatment that's available for our patients. I think as we work to do all of these things, it's important that we do so with that time and attention model in mind, and that we want to be able to grow and expand and meet this need and provide these services to our patients. But at the same time, we want to retain what made Memory Move special in the first place.
Yeah, that's a non-negotiable for sure. Yep. And Julie hit the nail on the head. Growth is great, but it has to be measured growth, and it really can't change the culture and the mission of the organization. And so we very much have that top of mind, and we continue to remind each other of that as well. So thank you for that. So why don't we turn it over to questions from the audience?
We've had a few that came in, printed them off, that came in with registrations, but if anyone has additional questions, please feel free, if you're in the room, just speak up. If you're on Zoom, just turn your microphone on and you can ask your question, or if you prefer, you can type it in the chat box and we'll read it. And someone asked earlier, talking about books and podcasts, I think that was a suggestion for a future session. We haven't yet. On our website, there's a link to some resources, and there's some book recommendations in there. And of course, Dr. Edwards' podcast.
We're not allowed to recommend anything other than this podcast.
There are some things there. Okay. Well, I think we've actually addressed a few of these. Somebody asked how they might get more personal caregiver advice like they received from Dr. Edwards.
Well, I'll hit that one, and feel free to chime in there. As Julie mentioned, part of our growth has been the creation of a family care navigator team. And these are a combination of social workers, care managers, individuals who have experience in what we call the social services and are complementary and now really integrated with our clinical team. And one of the things we're working on is how to really fine tune that integration so they are very much in line with the clinical team as part of your provider team. So the relationship for patients and caregivers who come into our family, we call it a family, is with the physician as the head of that team. And part of that is building relationship with their nurse and with their clinical team, and soon to be a stronger alignment with their family care navigator. And so their role is really to be complementary to our physician teams, to identify the resources either in the community or things that we can provide that can address current needs and issues. So that's part of the work that Julie's working on with me to really fine tune that integration. Okay. Anybody have any comments on that? I know that's one of the things that you love. I can't believe we have resources actually. You can say, oh, can you help with this? Yeah. Yes.
Yeah, I don't think I can be as good as Dr. Edwards.
Oh, we don't know.
But really, that's something that as a geriatrician we aim to achieve, to give advices. And I've never talked this much in my primary care career because that's 15 to 30 minutes, and it's hard to have conversations, whereas the way I practice right now, I get a lot of time. I'm sorry that I was late because I was
I know exactly. Well, we said you were practicing time and attention with your patients, that's why you're not here.
But I make it a point that we address all the issues and questions.
Why you water at the end of the day.
Yes.
There are two questions here that sort of overlap to Dr. Thomas. So I'll ask the one that captures both. This is from a physical therapist who works in the community, who refers a lot of clients here. So thank you. I think that's you. And do you want to ask your question yourself, or shall I read it?
No, go ahead.
What is a perfect referral for you? What patient population are you most interested in specifically to your referrals? And the other sort of overlapping question was whether you'd be seeing both memory and movement patients or one specialty over the other.
Good question. I'm a geriatrician, I should say. I don't like to put barriers, but typically it's 65 and over is where I've practiced, but then I've also practiced primary care, so I cannot say a differentiate between ages. As I said, when I try to see somebody, I'm not just focused on the memory. Of course, many of my patients might be coming with memory issues, but then I'll also address the movement issues. I'll also address their medication issues. I'll also address their frailty. I'll also address what matters most. I'll also address their comorbidities, like other medical problems that they come with. So I wouldn't kind of differentiate, but if there was one thing that I can be good at, I'm not saying it, but I think memory and memory-related issues is something that I can help better. But I can look into everything else. And of course, I have the help of other specialists in our office where I can freely ask them any questions.
I think the other thing that I think all the providers are really, really good at is identifying potential balance issues and gait issues, and really trying to intervene early so that you can preempt the fall. And so I know Dr. Edwards used to say, oh, I could just see somebody walking down the hall and, he can already tell, he can diagnose, but he can also tell. So I would say the large majority of our patients have referrals for, one one or two of the therapies. And physical therapy probably, being the dominant one. Because the fall risk is just so detrimental and can accelerate, other issues. So we're definitely in front of that one, sure.
Okay, the last question that was sent in with registrations is about statins and brain health, and that's actually all it says. So I'm assuming the question is, what's the connection between statins and brain health?
I'd say it's controversial.
I know it.
But you ask an internist what they think. I think the landscape is changing, is what I'm going to say, where there was some issues, some reports suggesting statin causing memory changes. And then they looked at studies that didn't confirm that. And now there are some longitudinal studies that are looking at the benefits of prevention of statins. So prevention of Alzheimer's dementia with statins. So it's still in the air, up in the air. I think if somebody has a reason to be on statins, so somebody who had a history of stroke or a heart attack or a clogged artery, then I would strongly recommend going on a statin, because you don't want stroke or any compromise that could affect any changes that has already happened in the brain. So I certainly would recommend those individuals be on a statin.
All right, any other questions from anyone in the room or on Zoom? Well, we want to thank Janet for moderating this conversation, and a million thank yous to Dr. Thomas for extending your day for one more hour time and attention to this, and the same to Julie. And thank both of you for being here. You're making the office better, and I know we're still counting in weeks, but we can feel a difference.
Yeah.
So thank you. And to everyone else, if you were here for the beginning of the session, we chatted a little bit while we were waiting for Dr. Thomas's last appointment to finish about the next several editions of Take Charge Live. We really do want to incorporate your ideas. So on the website, right where this recording will be in a few days, there's a short form where you can just submit your idea and your phone number in case I need to call and ask you what you're talking about. And that's pretty much it. So if you have an idea, if there's a topic you'd like to learn more about, we want to see how we can address it for you and help you and make this the most useful hour of your week. Okay, thank you.
Well, thank you to Melanie. Melanie puts this together like clockwork, gets it all organized, makes it look easy. But she does a fantastic job and always has cookies and treats for us. So help yourself. No. All right. Bye, everybody.
Thanks.